TENS. TENS means Transcutaneous Electrical Nerve Stimulation. TENS is a non-invasive electrical modality. It passes through the skin, which means transcutaneously, as the name suggests, and stimulates the sensory nerves by stimulating the pain gate mechanism or the opioid mechanism. Analgesia means inability or relief from pain. Hypoalgesia means decreased sensitivity to painful stimuli. Different types of TENS include: the first one is high frequency TENS, also called as high TENS or conventional TENS. So you can remember this as hi-fi. So HI for high frequency TENS. So frequency is increased and I for intensity. So if frequency is increased, intensity will decrease. So high frequency TENS comprises of high frequency and low intensity. It stimulates the large diameter fibers, that is the A beta fibers. Frequency used is 100 to 150 Hz. Intensity is about 12 to 30 milliampere and duration is around 30 minutes. Next we have the low TENS, also called as the acupuncture TENS. It comprises of low frequency and high intensity. Since it is high intensity, sometimes it might produce a muscle twitch. It stimulates the small diameter fibers, that is the A delta fibers. Frequency used here is 1 to 5 Hz and intensity is around 30 milliampere. And duration for low TENS is not more than 20 minutes. Next we have the burst TENS. It is made up of high frequency and high intensity. It combines conventional along with the acupuncture TENS. That is, it stimulates both the nerve types at the same time at high frequency and at high intensity and interrupted at a rate of 2 to 3 bursts per second. Next we have the large diameter fibers and the small diameter fibers. You need to remember that the large diameter fibers are the A alpha and the A beta fibers. The large diameter fibers help in transmission of fast pain. The receptors are present in the skin. Whereas the slow diameter fibers comprises of A delta and the C fibers. They help in slow pain transmission. Receptors are present in the skin, muscles or the ligaments. TENS produces pulsed rectangular form of a current. The TENS machine has 2 channels and 4 lead wires. Each channel has 2 lead wires. For small areas, use 2 electrodes, and for large areas, for example in case of low back pain, use 4 electrodes. The area of pain should be centered between the 4 electrodes or between the 2 electrodes. Applying TENS continuously, like for 24 hours, is usually not preferred. That is, use for 1 hour, then stop. Once the patient experiences pain once again, put on the machine again. You need to place the electrodes in a crisscross manner. Prior to applying the electrodes, wash the skin and air dry the skin. The electrodes can be placed over the area of greater intensity of pain or the dermatomes or superficial nerve proximal to the pain or over the nerve trigger point. Contraindications and precautions for TENS. Contraindicate if the patient has cardiac pacemaker because it can interfere with the frequency. Contraindicate in the first 3 months of pregnancy in case of open wounds, over the mouth region, near the eyes, in case of dermatitis, Around the carotid artery region, that is in the anterior 2/4 portion of the neck, because it can cause sudden fall in the blood pressure. In case of epilepsy, because it can predispose to epileptic attacks, and also contraindicate in case of uncooperative patients, that is extremely young or extremely old individuals, because they might not understand the precautions properly. Adverse effects, it can result in allergies due to the gel or the electrode placement. TENS is used in acute conditions as well as chronic conditions. Acute conditions is when it lasts for about 3 to 6 months. In acute conditions, it is painful. Why? Due to inflammation of the nerves, that is due to release of bradykinins and cytokines. Chronic conditions means when it lasts more than 6 months, it is usually less painful because there is no inflammation of the nerves. Previously, where we had talked about the pain gate mechanism or the opioid mechanism, you can refer to my previous video which is on the pain gate control theory or the pain gate control mechanism. The link will be provided in the description box.